Okay, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen, and right now we're just getting our first look inside the shoulder. This is the biceps tendon on the left side of the screen, and this is where the anchor is a little bit loose, so we're going to be dealing with that also. The rotator cuff tear is to the left of that, so this is the rotator cuff tear right here, and we already know we got a big tear to deal with there, so we'll be working on that in a minute. As we look around the rest of the joint, looking for any arthritis or anything else we can do inside the joint, other than some inflammation in the joint capsule and maybe a little bit of arthritis on the humeral head that we can see there, a little bit of arthritis on the glenoid where we can see here this is a little bit thin but not too bad. There's really not much else to worry about inside the joint. So what we're going to do now is work on the biceps tendon. We'll take a spinal needle and then we'll take a shuttle relay. And then we'll show you some more in just a minute. I'm sorry, I'm not looking here. Grab a grasper to her. Okay, so here's the spinal needle coming through the middle of the biceps. We'll take a shuttle relay, or for a while now it's been called the super shuttle, so we'll take that. Hold the camera here, two hands, just like that. One hand on the light cord, just like that. So we're just passing a wire through right now. There you can see it. Okay, hold right there. And now we're just going to reach in here and grab it. We'll back the needle out. And now we're going to load that wire with a suture. And then we'll pull back on the relay and you'll see that blue suture go through. So now you can see what's happening there. So now we're going to repeat the process one more time with our spinal needle. Hold that. That looks like a pretty good spot. It's right through the, rotate the camera, rotate the eye up, yeah. Okay, I like that. So we'll go ahead and feed through right there. Pause. You know how to pause on this? Hold down the button for a long time. Hold it down. Just keep pushing on it. No. Okay, we've released the biceps. You can see it's no longer there. After securing it, once we release it, it retracts a little bit, but we've got a good hold on it. You can just see the cut edge of it. Just see the cut edge of it to the left of the cannula there. And so now we're going to finish up inside the joint and get to work on the rotator cuff. You can see the tear right here. That's all exposed footprint. We shouldn't be able to see any yellow bone there. So we'll go off on the video, show you some more in a little bit. Okay, so here's the tear. Pretty good sized tear. Hold the camera for a minute, please. And we're going to put in our shaver just because it has a little ruler on the back of it. So if we go way up here, those are the sutures for the biceps tendon, so you can see them right there. So we know that's way anterior. That is all the way to that line, I believe, is a centimeter. Let me check that. Yeah, that's a centimeter. So as we measure this tear, from where we have good tendon, it's 1.5. And it's right at 2.5 centimeters. Okay, so we're going to go ahead and put a burr on here and get to work on taking off any bone spurs first. Camera there. Okay, I just want to show you where we're at. We've already passed and tied all 3 sutures from the very first anchor. Now we're going to pass and tie 3 sutures from a second anchor. We'll show you some more when we're done with that. Okay, so we've passed 2 anchors and 6 sutures. That's repaired. I'm happy with the way that looks. We've still got to deal with the biceps, and we'll do that in just a minute. But at least for the rotator cuff part of the repair, I'm happy with the way that looks. Okay, we've got a little bit of room here to little holes in the greater tuberosity as well. But the next step is to go ahead and work on the bicep suture. So we'll get to work on doing that in just a minute. Okay, we're all done. There's our sutures holding down the biceps tendon, and that looks real good. So as we look back over here, we're looking from the back now. So here's the cuff repair. We're going to do one last thing, and then we'll finish up here. So good luck to you now. Bye-bye. Actually. Okay, so here's the final thing we're going to do. We're going to take a mallet, and we're just going to tap this down gently into the bone and create some vascular channels. Go for it. Keep going. Harder. Okay, there's one. And I think that may be it. Maybe we can get one more up here. Okay. And then when we turn down the pump pressure, you'll see what happens. You'll see some of the bone marrow elements start to come out of those little tunnels. See, they look like little fat droplets, little yellow. See, coming out? That's the bone marrow starting to come out. So good luck to you now. Bye-bye. And there we're just laying the blanket down.